Details are finally surfacing about how the state wasted $93 million by funneling it through the Idaho Health Data Exchange. The scandal reveals the ramifications of the government's efforts to conceal operations in cash through creating unaccountable nonprofit groups. It is obvious that programs like this were not created with taxpayers' best interests in mind. So how did the issue escalate to the bankruptcy of an entire program and $93 million down the drain? Also, why did the government get access to all Idahoans' private medical data in the first place? We will dive into these issues and more on this week's episode of Fiscal Fridays. Ultimately, the lack of transparency and accountability built into the program became its own undoing. The Idaho Health Data Exchange was the product of a legislature-created commission to modernize health information in Idaho. This was largely supported by federal grants funneling through the Department of Health and Welfare. Though the exchange was a nonprofit organization created by the state and operating with public dollars, there were no formal systems of accountability. These issues were magnified when the group outsourced management to out-of-state consultants in 2019. Normally, government entities are required to go through a competitive procurement process to contract with third parties for services. This legal requirement for them is to help them search for subcontractors who could build a better product for less money. But because of the relationship between the exchange and the IDHW, they did not go through this process. In addition, they paid $22 million over 6 years to improve the program despite exceeding the scope of the contract agreement. Despite all this, the exchange was still falling short of its objectives. The legislature appropriated an additional $19.5 million to improve the exchange in 2020. The IDHW even front-loaded the funds but required more accountability. But the exchange was able to push back against accountability measures and failed to meet its obligations. They ultimately filed for bankruptcy in 2022 after losing a suit to a vendor whom they failed to send along pass-through payments from the IDHW. The wastefulness of this lack of accountability should raise alarm bells for taxpayers and legislators. The report from the Office of Performance Evaluations proposed several solutions to prevent a recurrence of this scenario. First was to reconsider the authority under which public officials can create nonprofit entities, increase transparency for public-private partnerships like the exchange. IDHW should take steps to prevent scope creep in procurement exemptions, and the Department of Administration should have oversight of procurement exemptions. These recommendations are timely as the state is entering yet another relationship with a state-created nonprofit organization, this time for the purchase of the University of Phoenix under the banner of the University of Idaho. In the meantime, the exchange still exists and still has a relationship with the IDHW, despite the fact it is now weakened. There is still about $10.5 million in unspent federal grants from 2020 in the ether for the project. Legislators and the IDHW alike now must pick up the pieces and figure out how best to proceed. Ultimately, the government should have never been involved in the collection and management of Idahoans' personal health information. During its operations, national IT experts expressed their concerns that the exchange was not meeting the appropriate security standards for safeguarding this information. The problem? Every Idahoan could potentially have their personal information on the exchange and experience a data breach. This program was nothing less than a government power grab to drive Idaho toward a government-centralized and managed healthcare system. The information on this exchange was linked to things like the vaccine surveillance system and other programs that check in on your health. The OPE even mentioned that there is no evidence that government-managed health data exchanges are any better than private options. Many electronic health data exchanges are already working out the issues in this space without the government's help. Presently, only 9 states offer a government exchange. It is time Idaho departed from this small and outdated group. In the words of our Legislative Affairs Director Fred Birnbaum, The exchange should be a wake-up call for the dangers of so-called public-private partnerships attempting to run our healthcare system. This is what Medicaid managed care would have been too. In all, these nonprofit organizations provide an avenue for public monies to be expended without any oversight from budget writers in the legislature or the taxpayers. We still don't have all the information about the issues with the exchange because of their status. There needs to be a fundamental change to the powers of these executive agencies. This would hopefully put the taxpayers back in charge to prevent a repeat scenario in the future. As always, we would love to hear what you think. Should the government agencies be able to create these unaccountable nonprofits? Tell us in the comments below or by sending us a message at media@idahofreedom.org. Also, if you would like to opt out of your information being collected and shared by the exchange, find a link in the video description below and file an opt-out form with the Department of Health and Welfare. For more episodes of Fiscal Fridays or other great content from the Idaho Freedom Foundation, please visit idahofreedom.org.